Please enjoy the convenience of Optimal Anesthesia, your go-to source for anesthesia information. We'll be talking about something quite substantial today: medication that acts as both an agonist and antagonist to opioids. Opioid agonist antagonists are an interesting category of drugs because of the many ways in which they interact with the opioid receptors in our bodies. Because of their dual agonist and antagonist properties, they serve as a kind of middle ground option in the field of pain treatment. We should get down to brass tacks right now. Let's begin by introducing the main players. Pentazocine, our first character, a partial agonist/antagonist, interacts with mu, delta, and kappa receptors. Picture it as a reliable sidekick for moderate pain. Butorphanol, this one's got a bit more kick with its partial agonist/antagonist action at mu and kappa receptors. It swoops in to rescue us from postoperative pain and migraines. Nalbuphine, a trusty companion with partial agonist/antagonist properties at mu and delta receptors. It's your go-to for cardiac catheterization and maintaining analgesia. Buprenorphine, our superhero in this group, primarily binding to mu receptors. It's got the power to tackle moderate to severe pain like a champ. Assume you're at a clinic and your consultant gives one of these medicines to a patient. You had to be wondering what the dosage is, right? So, here's the lowdown. Pentazocine dosages range between 0.5 and 1 mg per kilogram of body weight. It takes 15 to 30 minutes to start functioning, and it keeps on working for 3 to 4 hours. The typical butorphanol dosage is just 0.01 to 0.02 mg per kilogram. It works quickly, within 5 to 10 minutes, and effectively, for 3 to 4 hours. Nalbuphine's effects may be felt within only 2 to 3 minutes after administration at a dose of 0.1 to 0.2 mg per kilogram. It will remain for 3 to 6 hours. Finally, our super drug buprenorphine may be taken at a low amount of 0.001 to 0.006 mg per kilogram. It takes 15 to 30 minutes to kick effect, but once it does, it lasts for 8 to 12 hours. Now, let's talk about their strengths and weaknesses. Picture pentazocine as your friendly neighbor who helps with moderate pain. It's a partial agonist/antagonist, so it offers pain relief without going overboard. But watch out for side effects like sedation, nausea, and even dysphoria in high doses. Butorphanol steps in as the handyman for postoperative pain and migraines. It's efficient, but don't forget that it can cause sedation and a slight increase in blood pressure. Nalbuphine is your dependable friend during procedures like cardiac catheterization. It's less likely to affect your blood pressure but might cause sedation and some dysphoria. And then, we have buprenorphine, the superhero of the group. It handles severe pain like a pro. However, it can make you drowsy, nauseous, and its effects are resistant to naloxone, which is used to reverse opioid effects. Plus, it may trigger withdrawal symptoms in people who are dependent on other opioids. So, in conclusion, opioid agonist antagonist drugs are like the versatile actors of the pain relief world. They offer the right balance of relief and caution. They're not without their quirks, but when used wisely, they can be powerful tools for managing pain. That's it for today's Optimal Anesthesia. We hope you found this exploration of opioid agonist antagonists enlightening. Remember, when it comes to medications, always follow your healthcare professional's advice for the safest and most effective treatment.